Hi there, my name's Kate Dooley. I'm the Institute's Regional Director for West Africa. For the past 6 years, I've actually been living and working across the West Africa region, primarily in Sierra Leone. And in the last 2 weeks, I've found myself in lockdown in London, like everybody else here. So I'm working from home, following the rules. And so my typical day looks a little different. I'm now maintaining my role as the regional director, but also supporting all of our teams working across 14 countries on the public health crisis response. So we have a number of teams embedded in crisis management systems, emergency operations centres and president's offices working on the public health crisis. So my typical day is on the phone a lot of briefings that I'm helping to prepare centrally to help advise governments right across the continent. So we've reorganised ourselves and have split up our management responsibilities amongst the central team to help support the advice that we're providing through our teams on the ground across both the health and economic aspects of the response. So I'm leading the public health part. And what we're doing centrally is continuing to provide dedicated and ad hoc support to our individual teams. We have very specific requests coming from a range of governments. For example, in Burkina Faso, the government there has asked us to help work on enhancing the call centre they have for their national hotline, which is a really critical resource in crisis management for an infectious disease, because you need somewhere for people to go and to call up if they suspect they have symptoms, and to be able to access some kind of response, and for that data to be tracked, because it's incredibly valuable for planning purposes. So we have ad hoc things like that, but we're also ourselves centrally a repository of knowledge and information, and have some capacity that we've allocated so that we can be doing the analysis to help anticipate what governments are going to need next, what those immediate kind of urgent questions are going to be, not just today and tomorrow, but next week and the week after, because coronavirus unfortunately really is just getting started across Africa. And we know that there's very limited testing capacity, and so the true numbers are unfortunately very much likely to be much, much higher in reality. So we're going to see things change rapidly on the ground. Our teams are out there responding, and so us at the centre are really helping by churning out some of that advice around what the appropriate social distancing policies are, what the experience was that we ourselves had during the West Africa Ebola outbreak in 2014 and 15, and what lessons that we can have to offer from that experience. We're also looking ahead to what's happening elsewhere that's relevant. So India has a very large, high dense population, very poor communities in a lot of cases, under full nationwide lockdown right now. We're looking at how is that playing out? How is that working? What are the lessons, good and bad, that we can take from that and pass on to the partners we have across Africa? There's a lot changing very dramatically, very dynamic situation and very complex. So us in the centre are working really just to be a repository and be as helpful as we can to our teams and to our governments.